How to help your baby stop constantly wanting to breastfeed, a comprehensive guide. It's not uncommon for babies to become highly attached to breastfeeding, especially as it offers comfort, security, and emotional connection. However, when a baby begins to develop a habit of wanting to breastfeed constantly, it can become challenging for both the mother and the baby. If your baby is showing signs of frequent breastfeeding and you're considering weaning, it's important to approach the situation gradually and with patience. Additionally, if your baby is using their teeth to gnaw or bite your breast, it can be painful and frustrating. In this article, we'll explore how to manage and eventually stop the habit of constant breastfeeding, when to wean, and how to handle difficult behaviors like biting. Understanding why your baby wants to breastfeed constantly. Before you start trying to reduce breastfeeding frequency, it's important to understand why your baby might be asking to nurse so often. Here are some potential reasons. 1. Comfort and emotional needs. Babies often seek comfort and emotional security from breastfeeding. It's not just about hunger, it's a way for them to feel safe, soothed, and secure. If your baby is upset, tired, or anxious, breastfeeding can be their way of calming down. 2. Teething. Pain. As your baby grows, they might start teething, which can make their gums sore. Breastfeeding can provide relief for their discomfort, especially since the act of sucking helps soothe aching gums. Some babies might even chew or bite on the breast when they are teething, causing frustration for the mother. 3. Growth spurts. Babies go through growth spurts, during which they may want to nurse more frequently. This is a normal part of their development, as they are trying to get enough nutrients to support their rapid growth. 4. Nutritional needs. Some babies might seem to breastfeed constantly due to hunger or needing more milk, especially during their early months. They may seek comfort from the breast if they haven't had enough to eat, or if they are going through a growth spurt. 5. Habit formation. As babies get older, they might develop a habit of breastfeeding regularly, even when they aren't hungry. This can become a pattern where they use breastfeeding for comfort or out of routine rather than out of need. When to stop breastfeeding. The right age for weaning. Breastfeeding duration is a personal choice, and the World Health Organization recommends breastfeeding for at least the first 2 years of a child's life, alongside the introduction of solid foods. However, there is no set age at which you must stop breastfeeding. Weaning is a gradual process that can take place when both the baby and the mother feel ready. Infants, 0 to 6 months. Exclusively breastfeeding is recommended for infants, as breast milk provides all the necessary nutrients. However, if you feel that your baby is breastfeeding excessively or for comfort, try to establish a routine. Babies, 6 to 12 months. At this stage, babies are usually introduced to solid foods, but breastfeeding can continue. If your baby has formed a habit of frequent nursing, it may be helpful to begin slowly reducing nursing sessions during the day. Toddlers, 1 year and beyond. After the first year, you can continue breastfeeding if you and your baby are comfortable. However, if your baby is nursing excessively and you're ready to start weaning, this is a good time to begin introducing alternatives like sippy cups, snacks, and more solid foods. How to start the weaning process. 1. Gradually reduce daytime feedings. One of the best ways to reduce breastfeeding is to gradually shorten the duration of each breastfeeding session. You can replace 1 or 2 breastfeeding sessions with formula or solid foods, depending on your baby's age. For example, if your baby is used to nursing every 2 hours, try stretching the time between feedings by 30 minutes each day. This helps your baby adjust slowly to the change without feeling deprived. 2. Introduce a sippy cup or bottle. If your baby is older than 6 months, it may be time to introduce a sippy cup or bottle to replace breast milk with formula or water. Offer the sippy cup during the times when your baby would usually breastfeed. Don't force it. Be patient, as your baby might resist at first. 3. Offer solids and snacks. Solid foods are a key part of the weaning process. Gradually increase the variety and quantity of solids your baby is eating. You can introduce more snacks between meals to keep them satisfied. At this stage, your baby may also be drinking more liquids, which can help reduce the desire to breastfeed. 4. Create a new comfort routine. If your baby is nursing for comfort, try to offer alternative soothing methods. You can try comforting your baby with cuddles, a soft toy, a pacifier, or gentle rocking. Establishing a new bedtime or nap routine that doesn't involve breastfeeding can also be helpful. 5. Night weaning. Many babies, especially older babies, continue to nurse at night. If you are ready to stop breastfeeding at night, you can start by gradually reducing the number of night feedings. Offer other forms of comfort, such as rocking or padding, instead of breastfeeding. 6. Be consistent but gentle. Weaning is a gradual process, and consistency is key. However, it's important to be gentle with your baby. If they cry or seem upset when you refuse to breastfeed, offer other comforting alternatives and give them time to adjust. 7. Stay patient. Weaning is a big change for both you and your baby, so it's important to be patient. If your baby resists, it's okay to take a step back and try again in a few days or weeks. How to handle biting while breastfeeding. If your baby is using their teeth to bite or gnaw on your breasts, it can be painful and frustrating. Here are some strategies to manage biting. 1. Stay calm and remove them from the breast. If your baby bites while breastfeeding, gently remove them from the breast and say no, firmly but calmly. Give them a short break to understand that biting isn't acceptable. Reassure them that breastfeeding is for eating and comfort, not for biting. 2. Offer a teething toy or chilled teething ring. If your baby is teething, they may want to chew on something to relieve the discomfort. Offer a chilled teething toy or ring to soothe their gums before or after breastfeeding. 3. Monitor breastfeeding positions. Sometimes babies bite when they are not positioned correctly on the breast. Make sure your baby is latched on properly. A good latch helps ensure they're feeding properly without resorting to biting. 4. Feed. When your baby is calm, try to nurse your baby when they are calm and relaxed, rather than when they are distracted or overstimulated. This can reduce the likelihood of biting during feedings. Conclusion: patience and support during weaning. Weaning your baby off constant breastfeeding is a gradual process that requires patience and sensitivity. Every baby is different, so it's important to be flexible and adjust your approach based on your baby's needs and temperament. The key is to offer comfort, consistency, and alternative ways to meet their emotional and nutritional needs. Gradually reducing breastfeeding while introducing other forms of nourishment and comfort can make the transition smoother for both you and your baby. Remember to be patient with yourself during this process, and don't hesitate to seek support from your pediatrician if you encounter any challenges. With time, both you and your baby will find a new balance that works.